IVF failure hurts, and not just emotionally. It shakes your confidence, your sense of control, and sometimes even your identity. Most people expect IVF to be stressful while it's happening. What they don't expect is how devastating a negative result can feel after everything looked perfect. You followed the instructions, you took the injections, you showed up for every appointment, you did everything right, and still it failed. That's when the mind starts playing cruel games. Patients often blame themselves. They replay every step. They wonder what they ate, how much they walked, whether one small mistake ruined everything. Let me be very clear: IVF failure is not a personal failure. It is a biological outcome, not a moral judgment. One of the hardest psychological impacts of IVF failure is loss of control. Infertility already takes away predictability, and a failed cycle reinforces the fear that nothing is in your hands. Another common reaction is isolation. Friends announce pregnancies, family members ask uncomfortable questions, well meaning advice becomes unbearable. So, how do you cope in a way that actually helps? First, allow yourself to grieve. A failed IVF cycle is a real loss of hope, expectations, and imagined futures. Suppressing emotions only prolongs distress. Second, stop catastrophizing. One failed cycle does not predict your final outcome. IVF is a process, not a verdict. Third, regain agency. Ask questions. Understand what happened and what didn't. Knowledge reduces anxiety far more than blind optimism. Fourth, protect your emotional boundaries. You are not obligated to explain your journey to anyone. Silence is a valid coping strategy. And finally, stay connected, but selectively. Choose one or two safe people who listen without fixing or judging. Now, when should you seek professional help? If sadness lasts weeks without relief, if anxiety affects sleep, appetite, or work, if you feel numb, hopeless, or emotionally detached, if your relationship is suffering because neither of you knows how to cope, seeking help is not weakness, it is emotional first aid. A good fertility journey is not just about embryos and hormones, it's also about protecting your mental health while you pursue parenthood. You deserve clarity, honesty, and support, not fear based decisions. If you're struggling with doubts, confusion, or emotional overload after IVF failure, please use our free IVF chatbot powered by AI and based on my 40 years of clinical experience. Get your questions answered calmly, privately, and without pressure. The link is in the description. You are not alone, and you don't have to navigate this journey in the dark.